I want to show you how to build and distribute a home exercise program. To quickly recap, there are two main products in our solution. There's the native InHand Health patient app for your patients that they use on their smartphones and tablets. And then there's Physical Therapy in Hand, which is a web application where you as a physical therapist manage patient records, exercise programs, and other aspects of a plan of care. I will start this video as a physical therapist and build a home exercise prescription in Physical Therapy in Hand before transitioning to the patient's app in the second half. Okay, got it? Let's get started. Sign into your clinic at clinic.inhandhealth.com. Let's access the record of the patient we want to build a home exercise program for by clicking on his or her name in the dashboard. Select the Prescriptions tab, then click the New Prescription button. For this simple demo, let's pretend our patient is experiencing minor lower back pain and needs a few simple stretches to perform. Enter a name for the exercise prescription and any special instructions for the patient. These are presented outside the exercise video content. You can also adjust the frequency for the exercise prescription here. Next, select an exercise template, protocol, or individual exercise from the video library and simply drag it onto your prescription template. Once it is in place, you can edit sets, reps, seconds per rep, and any instructions or cues and tips by toggling the blue triangle button. Add as many exercises as necessary. For this simple demo, we will add one more stretch with another drag and drop motion. Note you can switch the exercise parameters from the rep space to duration. Adjust the order of exercising the prescriptions by dragging them up and down, with the top exercise being the first one your patient will perform. Remove exercises by clicking the red trash can icons. Save the prescription when you are done. From this screen, review the details one last time. Click the blue Edit button to make changes or the red Delete button if you need to start over. If OK, click the Prescribe button to send it to your patient's InHand Health patient app. Okay, so now we are looking at your demo patient's smartphone and the InHand Health patient app so you can see what the patient sees when he or she receives a home workout program. After launching the app and signing in, the patient sees your exercise prescription and begins by tapping the green Start Workout button. Here are the special instructions you entered, and next the app will download the exercise videos. By the way, the patient can switch to streaming the videos in the settings part of the app. Once downloaded, the patient taps on the first exercise and a narrated overview video explains the movements.
Child's pose. Keeping your hips tucked under, sit back towards your heel, keeping your hands stretched out forwards and close to your ears. Sit back all the way onto your heels or until you feel a slight stretch but no.
When ready, the patient taps the green Begin Exercise button and the Get Started button.
Child's pose. Position yourself to begin the exercise. Tuck your hips under, rounding your low back, pulling in your lower abdomen. Keeping your hips tucked under, sit back towards your heels, keeping your...
The exercise video then plays through the sets and reps you specified. For this demo video, we will now fast forward to the next exercise. Again, there's an overview video explaining the exercise and a performance video for the patient to follow.
Movement beginning in the upper back, then mid back, and progressing to the low back. Continue to breathe. Walk your hands back. All fours side bend. Position yourself to begin the exercise. Keeping your hips still, walk your hands toward the right, concentrating on movement beginning.
Note patients can review the details of the exercise in text form by tapping this option. Okay, again we will fast forward to the end of this exercise and show you how a session ends with patients asked to rate their pain, recovery, and progress levels. This data is collected and combined with compliance tracking as part of the Care Index stats, which we will cover in a future video. Finally, a reminder is then automatically set before the patient exits the app.